Just because someone uses drugs don't mean to count them out. That's somebody's son, daughter.
This is a serious crisis, and we can no longer afford to kind of put our head into the sand and pretend that this isn't happening.
I'd probably been drinking since I was 9 and using hardcore drugs since I was 11.
We've got to make the treatments and the connections to care easier to access than the dope. I mean, that's the bottom line.
Drug use continues to be an issue across the country, but one of the solutions is harm reduction. It can be a controversial topic. What is harm reduction? Harm reduction is an evidence-based approach that is critical to engaging with people who use drugs and equipping them with life-saving tools and information to create positive change in their lives and potentially save their lives. Some say it's enabling people to use drugs, but others, like you'll see in a couple of minutes, say harm reduction is saving people's lives and leading them to eventually get treatment for addiction. Like with anything, there are roadblocks and limitations.
So how have things been?
Good, it's hot.
It's really hot. Are you staying hydrated?
Staying hydrated.
I'm Courtney Downs. I'm a staff member at Virginia Harm Reduction Coalition. Have you been to another syringe exchange, like the drop-in center or anywhere?
I haven't.
Since your last?
No, I've just.
And I also used to be a registered nurse. Throughout my active using, I lost my nursing license and ended up homeless here in Roanoke. Anytime we can encourage anybody to go from injecting to smoking, it decreases overdoses, it decreases the risk of infections like endocarditis. I come from a background of domestic violence and trauma and mental illness. I'm a person in long-term recovery. I have 3 years and 8 months, something like that. Abstinence from all drugs and alcohol. I was hanging out with some people that were early participants of Virginia Harm Reduction Coalition, and even though I wasn't a direct participant, they Narcaned me with the Narcan that they received.
So this program saved your life?
Yeah, I wouldn't be here today without it.
So this is our memorial wall. It's for us a really good reminder about why we're doing what we do, what this work is all about. These aren't just names on the wall, they're people to us. And so it's hard to come in here and look and see how many people we've lost that we shouldn't have lost. The data is very, very clear. This saves people's money, this saves people's lives, and to me, there's no downside to harm reduction. We provide case management services, we provide HIV and Hep C testing and connection to treatment. We provide safer use supplies to stop the spread of HIV and hepatitis C, as well as prevent dangerous infections like endocarditis.
What are the results of harm reduction? How is it working here?
It's working really well. I mean, the data is very, very clear. Harm reduction in syringe services is an evidence-based solution that has been borne out over and over again. If you are in a member of a harm reduction program and are accessing services through a harm reduction program, you're 5 times more likely to enter substance use treatment.
We are packing kits. These are naloxone intermuscular kits. So we have syringes, naloxone vials. My name is Joe Bryson. I'm a volunteer here. Everything I see, the work being done is super important and saving lives every day and helping to put these folks on a path towards getting a little better.
You said you were going to get emotional. Why are you going to get emotional?
Yeah, because of the people on the staff here and the way they treat and respect folks in the participants in the program. It's just great. It's so much about respect and humility that any of us could be there, and how these people are, participants could be any of us, and that it takes some humility to take that view. Got interested because I'd read Beth Macy's books, and I was new to town and looking for something to get involved in.
I'm Beth Macy. I've been writing about the opioid crisis for more than a decade, including my 2 last books, Dopesick and Raising Lazarus. I mean, the first time I really understood harm reduction, I was talking to this treatment provider in New York State, and he said, I was a heroin user in the 90s. I went into a needle exchange, and they said, how can I help you? And he said, I'm hungry. And they gave me a sandwich. And that sandwich led him to go back and eventually start using more safely, and eventually connected to care. He got his family back, he got his job back, he went back to school, he has a master's degree. He runs a recovery center in Jamestown, New York. And so it's like you've got to build the lily pads to help people cross the pond to get there. But when you see it happening, I saw it happen to numerous people, homeless people living in tents, now sober for the first time in their adult life. I saw it happen over and over. It's this approach of bathing people in non-judgment, love, and social supports and connections to care that actually works. There's this whole world existing just barely below the surface. You don't have to go very far to find it. That is full of these people living on the margins and using drugs. There's this whole economy around it. If you're waiting for somebody to hit bottom, yeah, but the bottom has a basement and the basement has a trap door. And in an era of fentanyl, the bottom is death. So that's why we've got to get to them before the fentanyl does. We've got to make the treatments and the connections to care easier to access than the dope. I mean, that's the bottom line.
Talk to me about those policies. Is it a regional, is it a state thing? I mean, it seems like there's a lot of barriers depending on where you live.
At the beginning of doing this research, I kept asking people like for that magic wand, like solution, right? And certainly the federal government could do X, and then we began to work on that treatment gap. But what I learned was public health and the way we treat addiction is very much part of each community's basket of gifts. The way they do it in New York is not going to fly in Roanoke, Virginia, is not going to fly in Wise, Virginia, or Lee County, Virginia, right? So we're not going to have safe consumption sites. What can we have here? We can have needle exchanges and harm reduction centers. Somebody in West Virginia told me, if the rapture's coming at 8 o'clock tonight and you got to use, you're still going to use. Until they do something to fix the fear of withdrawal and dope sickness, they're going to keep using. This idea that just putting people in jail might make the politicians look good because they can say, oh, look, see what we're doing about the opioid crisis? It just doesn't work.
Talk to me about the skepticism.
We believe that every single one of our participants has the potential to turn their life around, to become healthy and happy and connected into their communities, but they can't do that if they're dead. And so when people say that syringe programs are enabling, I completely understand where that comes from. I was raised with that same philosophy. What I say to those people is that a harm reductionist will never try to glorify the use of drugs or minimize the real harms associated with injection drug use, because we see it every day. We are very clear on the impact of drug use, not only on a community but on an individual level. And what we are here to do is to love those people and say you are worthy of that love, and take care of them and support them so that they can make the changes in their life that they need. Harm reduction is, to me, really only limited by the climate that it's in, right? And when people get to know us and get to know our program and know that we're not just throwing syringes at people and leaving them to their own devices, that we're providing comprehensive wraparound care to support not just their needs to stay safe while they're using drugs, but their housing needs, their mental health needs, their treatment needs. You know, we're trying to provide a holistic response to this. And really the only limitation to that is funding and support of the community members. And we're really lucky to be in an area that is incredibly supportive. So we kind of see ourselves as the on-ramp. And then once they're in a different place and they don't need our harm reduction resources, we can then hand them off to agencies that are better equipped to help them with their recovery journey.
You definitely want to stay hydrated and keeping the sunblock on.
Yeah, thank y'all.
People deserve the dignity and respect, whether or not they choose to be abstinent or not. They deserve clean supplies. They deserve connection. They deserve love. You know, we don't get to be the judge of that. You don't realize it saves the person that comes and gets the supplies, but it's also like puts a bubble of safety around their immediate circle as well.
Harm reduction, again, isn't just about throwing syringes at people. It's about building strategies and tactics to use safer so that we can keep people alive so they can get the help they need.
Virginia only has 12 comprehensive harm reduction sites across the state where syringe services are legal, and people drive for hours to get to one of those sites. They'll serve anyone who shows up. Virginia Harm Reduction Coalition is helping the community as well by getting rid of 100,000 syringes safely every year.
We'd like to hear what you think about the topic. Leave us a comment below. And be sure to subscribe to our Solutionaries channel. We're just getting started.